sorry about all the confusion with the links, but I think we got it together on the back end. I think we just needed to disable.
Great. And Laura, we haven't heard from Shayla, and I'm assuming Janet's going to be able to log in with the new link that Lasheen just sent.
Should be able to.
Great. We'll just give her a second. In Shayla's absence, Janet, as the co-chair, runs the meetings, everybody. I do apologize for this. It's not usually like this, so quite sure what's happening, but it looks like Laura and Autumn and Lasheen are on it.
I also put the public registration link in the chat. I don't know if you guys can see it if you joined after I put it in the chat, but if they aren't getting their individual links, just send them to that link. And then I'll just promote them to panelists when they come through. That might be quicker actually than waiting for Zoom to send it, because sometimes Zoom sends it when it wants to. Sometimes it's automatically, sometimes it takes a little bit.
Alrighty. I don't see it in the link, but I know I was one of the last people to log on in the chat. I'm sorry.
Okay, let me resend it.
I signed in with the panelist link. I got 2 emails and the first one didn't work. So then I tried the second one and it worked.
Thanks, Sherry. Janet or Autumn, are either of you hearing? I'm sorry, Laura or Autumn, are either of you hearing from Janet?
I have not.
I am emailing her, just helping her out.
I just hate to hold everybody up if we're not going to have a quorum. Well, I guess we could at least introduce ourselves, right? While we're waiting. Let's see, Jerry, and Laura and Autumn, we have 2 new advisory board members, and I'll just ask you guys to introduce yourselves if you don't mind. Counselor Pinkston, would you go first?
Hi, good afternoon. I'm Brian Pinkston. I'm a recent addition to Charlottesville City Council and was appointed to be on this board, and I'm glad to be here. And I appreciate all the good work that you all do in this arena of social services, and here to learn and listen. And if there are specific ways you think I could advocate for your work with others on City Council or with the city manager or anything along those lines, please feel free to let me know. Thank you.
Mr. Brew?
I am Connor. I work as the Community Outreach and Community Engagement Director at Movement Church, which is a local Charlottesville-based church. Pretty passionate about kind of working in our community and getting to know the needs of our community and doing whatever I can to advocate for the members of our community that I interact with, and kind of learning more about what the Department of Social Services does and how we can kind of plug that more effectively into the needs of our locality.
Thank you.
Yeah.
Thank you. Jerry? Oh, you're muted.
Sorry about that. I was saying I left an appointment. And I work for Charlottesville City Schools with the English Learners Program, K-12. I do family support engagement and work with the teachers and staff to help support all of our English learners and families. And I also work for TJACE at PVCC, which is our PVCC adult education program, teaching an English class to adults and coordinating volunteers for that program as well.
Autumn?
Hi, my name is Autumn Balzer. I am the administrative assistant for the department, and I've been here about 2.5 years. And yeah.
And then Laura.
I'm Laura Morris. I'm the Chief of Administration. I oversee budget, finance, and personnel for the department.
And Lasheen Parks, I'm not sure if you all have met her. She's the woman behind the screen, makes everything happen and facilitates a lot of these virtual meetings in our new normal. So thanks, Lasheen. We appreciate you a lot. Laura, any update from Janet or thoughts about how we should proceed since it's now 40 minutes after the time we're supposed to start?
Autumn has been talking with her, so I don't know an update. Sorry. But I think we just move ahead and we skip over approving the minutes.
Okay. All right, so if we're moving ahead without the minutes, then that leads to the members report and the chair report. And then I just have a couple of quick updates for you all. So is there anything that any of you had for the good of the group to share this morning? No. Sherry, I was wondering if you would have had any information yet. I'm sure it's too early, but about what is being anticipated in our area about any refugees that might be coming from the Ukraine.
Very, very early. I was just talking to my friend from Ukraine who works as an ESL teacher, and she was saying that she hoped that that would happen. I haven't heard anything yet. I can talk to somebody, but also I know that we're over capacity with all of the Afghans that came in, and so are a lot of other places, but I hope, and affordable housing is a big issue. So we still have a lot of families in hotels, which is, you know, they're having to provide meals for them because they're not able to cook. So that's adding up quite a bit. But I would love to have some refugee families from the Ukraine. I think that would be wonderful.
Thank you. Anybody else have anything they wanted to share for the good of the group? Okay, I have a couple of quick updates from the department. One is from our benefits division. The biggest challenge we have there is that with the ending of the public health emergency, we are now having to resume review of our Medicaid cases, which we have not had to do for the last 2 years. One reason why our caseload has really swollen during the pandemic. It was an effort to make it easier for people to keep their health insurance and get preventative and emergent care when they needed it. So we, over the next couple of years, will be tying up what is now close to 1,600 overdue Medicaid reviews. So that's a significant workload. We're not quite sure how we are going to be required to do that, but it is, expect to hear more about that when we meet next. In our family services division, I would say the biggest challenge we have right now is recruitment. While we don't have a lot of vacancies, when we do have vacancies, we're seeing underqualified and very small pools. So we're having to move very quickly to make sure that we snag the qualified people that are out there that want to come work in Charlottesville. And that's difficult in the our current environment, mostly because we need a solid HR department to help us move quickly in those situations, and they just don't have enough people in the seats these days to manage the workforce that we have. So it's a little bit of a challenge, but we are working on it, and things are rapidly improving from our perspective, I would say. Laura can talk more to the biggest administrative challenge, but I know the top of the list is it's budget season. So our budget, while it has been presented to City Council, to the City Manager's office, we're not quite sure what is going to be included from our ask list when it finally gets presented to the City Council. And then on top of the budget, we of course are working on our plan to pivot completely to a mostly hybrid workforce as we move through and emerge from the pandemic. So most of our staff is going to be working from home. We do have face-to-face contact, but that's not really happening in our office these days, except for a few meetings. We're really doing most of our work out in the field. So those are the areas that we have on our radar moving forward. And then as a group, the biggest challenge we have is our annual report. And when we last met in December, the group talked about mirroring our structure that we used last year, talking about what's happened to our caseloads, what's happened to our workforce, and then the challenges and successes that we're seeing in a virtual environment. So if that's okay with you, we will proceed with that and have a draft ready. Laura, how do we get it on do we have a date by which we have to have it in to the council? Are we scheduled?
We do not have a date yet. So once we have a first draft to present to folks, then we can do the council memo to get on an upcoming agenda.
I'll be honest, I figured that's what you were going to say, and I don't have it ready for today, but I will have it ready for the next time that we meet. And I'll make sure that we get it out to you in plenty of time to take a look at before we meet, so we can have a robust discussion about it, okay?
So the other thing to discuss is if city offices do open, our next meeting would potentially be in person and not Zoom.
It might be helpful to review the circumstances for that. And Mr. Pinkston, please correct me if you have more accurate or more recent information than I do. But my understanding is that when the continuity of governance ordinance is ended by City Council, they have the decision on that. Right now, the emergency ordinance is in effect through March the 18th. And then after that, city businesses reconstitute to their normal status, which includes public meetings. Although the city is looking to move some meetings to hybrid or to only virtual, right now, the way the ordinance stands is when the period of emergency ends on March the 18th, then all city boards and commissions resume face-to-face meetings. Do I have that right, Mr. Pinkston?
That sounds right. I have not heard anything different, and I think that's probably the best direction for right now. I have been pushing making requests of the mayor and city manager for some updates along these lines, and I will do that today again. But at this point, yeah, that is the latest that I've heard. So I guess I would just encourage everyone to, be on the lookout for the latest or any revised information as it may come across. So sorry to give a non-committal answer like that.
No, I understand. I know there's a lot of balls up in the air. Laura, can you outline for us exactly what that means? We have been meeting every other month, which is the minimal meeting times that for us, and we've been meeting solely virtual. If we go to in-person meetings, does that mean we go back to meeting every month?
We could go back to meeting every month, but it would actually be, the board could vote to decide.
Yeah.
Because for the bylaws, the regulation is that we meet at least 4 times a year.
So it would be at your pleasure whether you wanted to meet 4 times a year, every other month, or go back to monthly meetings.
So I think there are many, the ones of us that are here are new or newish. I've only done Zoom meetings, and I think Connor and Brian can say the same. So, and you weren't doing these meetings before either, Sue, but maybe somebody else can speak to what are the benefits of meeting monthly. I think that I could try to make that work if we felt like that was necessary, or is that something that we would vote on each meeting, or yeah.
I think it would be easier for you guys to kind of decide once and not have to vote every single meeting.
Right, for sure.
But it's probably premature to decide today, other than to just start thinking about it. Because we don't know what's going to happen with the continuity of governance ordinance, and because we may have more options other than all in person or all virtual, or and we don't have a quorum today with only 3 of you in attendance. So we can't really make any changes anyway. Do I have that right, Laura?
Correct.
So right now, the next meeting would be, this is February, so it would be April, end of April, correct?
Partially correct. If we do reconstitute on March 18th, we could potentially meet in person in March.
So is it possible to run this by Shayla and have an electronic vote of the board on about the next meeting date?
Yes.
So Autumn, can you do that, please?
Yes, I can.
Thank you very much. Did anybody have any other questions or anything you wanted to talk about today? I apologize for the lateness and for the, the loose agenda here.
Do you have an update on what's happening with the Afghan families and housing and any kind of, because for the folks who are in hotels, are they getting, like, I know initially they said that they weren't going to get social services help, but then it was changed. So how do they determine whether it's city or county that helps them if they don't have a permanent home address?
That's a great question, Cherry. So we received that our community has received a significant number of Afghan refugees. What are we at now, Cherry? Around 200 families? Is that right?
Probably more at this point, I think. Okay. But yes.
So in Virginia, you apply for social services benefits in the locality in which you reside. It's the same as your school registration would be. And so for families that are in hotels, that's being considered their permanent residence. And so that's where those efforts are being sent. So if it's a hotel that's in the city, we have the case. If it's in the county, then the county's managing the case. And most of the hotels are in the county where the families are living that I'm aware of. And you know, we, like Albemarle Department of Social Services and both public school systems are pretty active members of the Refugee Dialogue Group, where some of those case staffings happen, and we just get information about what resources are available and what resource gaps have been identified as we move through this volume. But certainly housing is a problem. And the last conversation I heard was that most folks were being resettled out of the area just because of cost and availability of housing.
I know that they're not accepting, because we were having walk-ins. I'm just looking at the notes from the last refugee dialogue. 27% were walk-ins. So they left the like Fort Lee and some of the other areas where they were being taken care of because they might have had a friend or distant relative here. But 327 people have arrived from the Afghan Placement and Assistance Program. So it was supposed to be 250, but we got 327. But I also read that we are supposed to expect 140 refugee or SIV arrivals this fiscal year, but those might already be, you know, because a lot of people got stopped and they had to redo a lot of procedures because you have to have like your physical within 30 days and that kind of thing. So it's possible that it might be a lot of the people who were already planning on coming. But I'll hear more next time. Yeah. 108 cases, so that's 108 families, I guess.
Yeah, and not all of those families are being served by the Department of Social Services. I would suspect many are, but not all of them are. The faith community has been a huge player. Connor, maybe you could speak to that, but also International Neighbors and other nonprofits are really providing a lot of assistance to folks when they first get here, especially.
Right. I do know that the International Family Medicine Clinic, which is run by Fern Hauk, is no longer able to accept any new patients because of all those arrivals. So because of that, they are struggling to find primary care for anybody that arrived after that. I know we had a sick child at the high school today, and they are using Riverside, I was told. So that's good because it's still connected to UVA. But I think that they're low on staff like most places these days. And so they're just not able to accept anybody else. So that's kind of an issue. I mean, I don't think they get to determine who comes and who doesn't come, but I think as far as the IRC is concerned, but I think that if we get, for example, Ukrainian refugees because of the emergency situation, that's going to be a challenge. But I think that whenever there's a major crisis around the world, Charlottesville's very quick to help. And yeah, so hopefully they'll be able to find some spaces for them as well.
That is true. And just for especially new folks information, for public assistance programs like food stamps or cash assistance, any family that it qualifies financially and has legal presence in our country, it can apply for that. Everyone is eligible for some form of medical assistance if they have a need and apply for the program. And then for social services, say child protective services or adult protective services, your legal status has no bearing on whether or not we provide services there. I'm sorry, my cat is attacking me here on camera. There we go. All right, did anybody have anything else they wanted to talk about today? Well, we never really called the meeting to order since we did not have a quorum, but I see no public attendees other than us. So I feel like we can just end the meeting if that's okay with you all. And Autumn will get back with you about the next day and method of meeting. Okay. And look for a draft of the annual report out from our team for your guys' review and input, okay?
Great.
Thank you.
All right, thank you. Take care.
Thank you
Right.
very much.
Thanks.
Apologize for the slow start.
No
Okay,
Okay.
problem.
bye-bye.
Bye, everyone.